Just wanted to let everyone know that we are recording and live streaming right now.
Okay. And folks are still joining, so I would just recommend giving it another beat or two. First Lady, I think we are ready whenever you are. Okay, hello everybody and welcome. It's super exciting to be at our last meeting. This is just, it has been so much great work by everybody. This meeting is going to be shorter today because of the great work that's already been done. We're going to hear from the governor's legislative team. They're going to do an overview of bills during the short session that are going to be related to behavioral health workforce. So stuff that we've talked about throughout the talent council. If it's relevant, they're going to do a little report out about that. We're going to talk about the final report. All the feedback was incorporated, and so we're going to talk a little bit about next steps. And then I'll give you just a little debrief about a couple of the site visits we were able to have since our last meeting. Myself and governor's team were able to visit a secure residential treatment in Woodburn, and we were able to hear it was a fantastic residential treatment facility run by Telcare, and it was really incredible to listen to clients talking about navigating the system. And during that time, they are able to support their students through licensure and are able to compensate for that process. But because somebody is an LPC who is a supervisor and somebody is a CSWA, that actually is not, they're not able to get on-site supervision. And for anybody who's done work in secure residential, the importance of being able to do something on site can really matter. And so I just want to bring that story forward because it's a real world example that we just ran into last week, where somebody who's doing really important crisis work is saying it, may end up taking them 4 years as opposed to being just supervised on site. So I wanted to report that out to everyone and share that story. We were also able to go visit Capaces, which is located in Woodburn, and it's an organization that's providing community mental health to immigrants and farm workers in the mid-Willamette Valley. And we've been able to engage with this organization, as you might remember, around some culturally specific care. And it was just very helpful to learn about the expertise and some and feedback as we think about managing crisis and threat, um, and really thinking about trauma-informed standards as people are moving through some things that are both clinical and crisis. And so it was just really incredible to be able to go and see those folks. Lastly, we were able to visit Harmony Academy, and that is a recovery high school in Lake Oswego. And this is the first time I've ever been to a recovery high school. They are doing incredible work. And what is exciting is, as you all would imagine, that these are very likely going to be the workers of tomorrow. These are folks who have gone through the recovery high school process, and then they're able to hire peers who have graduated, and many of them are wanting to go into some sort of A&D treatment. These students were incredible, just incredible. And so, we suspected that it was probably an opportunity for pipeline, but to see that reflected and then to see students that were succeeding and thriving, and also just to highlight the invisibility of youth addiction. That was very and being there and thinking through your managing families and all of these other dynamics that are complicated. And so it was just exciting to see and another opportunity to think about where our workers of tomorrow are coming from and how we're gonna and how some of the great work that folks have done uh, is going to help prepare them to get in this field and to stay in this field. And so with that, I'm going to turn it over to Danny, who is the governor's deputy legislative director, to do an overview of the bills that are related to behavioral health workforce. And just to be clear, this isn't everything, but this is what we wanted to do is highlight all of the recommendations, the things that you all had suggested as recommendations, things that were coming from the legislature, much like we did the crosswalk with all of the other task force to see, when good ideas or suggestions are being brought up and adopted, we want to let you know. The goal is to get the work done and excited about whoever does it. So, Danny, you ready to go?
Ready. Thank you so much, First Lady. And good to see everyone. I know I was before this council around a month ago in mid-December to talk through some of the dynamics of session. Session starts Monday, so we're here. So just very exciting to be there, and also just want to thank on this meeting Eli, Julie, and Rick, who did a really great presentation during January legislative days on House Bill 4083, which Casey will do a little bit of a walkthrough on where we are after my part of the presentation. But just wanted to say again, thank you in this space. So as the First Lady mentioned, I'm going to do just a very brief walkthrough of four bills that we wanted to spotlight here today that cover the attempts to, I guess, expand the behavioral health workforce, similar to how we are doing through 4083. So Chad, if we go to the next slide. Yep, so that will be our path, and go one more, if you wouldn't mind. Perfect. So these are the four bills, and I'll kind of get into a little bit more detail. But just so you know, as of last night on the Oregon legislative website, all of the bills that have been introduced for the session, there's a couple hundred, are now live. So if you go to the Oregon legislative website, you can look up any of these specific bill numbers. There are ways to create alerts if you're curious about them and want to hear about their path through the legislature. So just want to note that up front as committees start to meet next week and things start to go pretty quickly. If you're interested in tracking these bills, there are clear ways to do that through the Oregon legislative website. Ready for the next slide? So the first bill to highlight is Senate Bill 1547, which is aiming to provide some alternative pathways to licensure. This bill comes from Senator Lisa Reynolds' committee, so the Senate Committee on Early Childhood and Behavioral Health. It was developed out of a legislative work group and introduced in coordination with the Ballmer Institute for Children's Behavioral Health at the University of Oregon. The bill would create a new bachelor's level license through the Oregon Board of Psychology for behavioral health and wellness practitioners. That's the definition that's used in the bill. The new position would specialize in early identification of some behavioral health concerns, psychoeducation, skills, training, and support, risk identification and referral, and then would collaborate with other behavioral health providers. There are some notable restrictions we wanted to just flag on what individuals with this new license type would not be able to do, again, presuming that the bill is successful this session. The new position does not diagnose, does not perform cognitive or educational assessments, or prescribe managed medications, or perform psychotherapy. And the new position also cannot practice independently, so it would always be in collaboration with other workers. And I'll just note too that the legislature has shown, I think, support for the Ballmer Institute in the past, including through bonding funding last session to construct a new building on their Portland campus for the Ballmer Institute Children's Behavioral Health Center. We'll go to the next slide. House Bill 4069, this was developed out of a task force that was led by Representative Travis Nelson and Representative Cyrus Javadi. The original task force came out of House Bill 4002 during the 2024 session. And there was a version of this bill last year that did not make it over the finish line. This would be to establish safety plans for behavioral health workers. So the bill last session, which was House Bill 2203, passed out of its policy committee, but did have a budgetary component, went down to Ways and Means, so the Joint Budget Committee, and ultimately did not pass. So a different version of the bill is being introduced this session, which I don't anticipate to have a fiscal. We'll have to double check on that. But the bill requires providers to develop and implement written safety plans. So there must be a plan for the safety of lone workers, a plan for the safety of the built environment, and then be able to provide information for workers that are statutorily required during training. Go to the next slide. Another bill that will be coming out of Representative High Pham's committee, which is the House Committee on Behavioral Health, is House Bill 4070. So this came out of a work group that was specific to tackling administrative burden. So I know our team's been tracking it closely to see, confirm whether there was any overlap, and we've been in conversations with Rep. Pham on how there's any interaction with House Bill 4083. I'll just say for this one, there's some changes around mental health and substance use disorder treatment laws that are just aligned with the work group's collective recommendations. So that's been an ongoing process. And I know if there's questions, I think Casey can get into more detail there. Clarifies that access to mental health and SUD treatment should be no more burdensome than access to medical treatment. I know there are some antiquated language in these broader statutes that this looks to clean up. So a lot of times that will be a recommendation out of a task force. And then also clarifies that tribes can establish and operate CMHPs. And then, like I said, removes any other outdated statutes. And then Chad will go to the last slide here. Thank you so much. And then this bill, House Bill 4115, comes from Representative Nathanson with a focus on streamlining background checks for behavioral health workers. The couple changes it makes around the background check and vetting process includes making background checks valid for 3 years, requiring those background checks to be portable between different care settings, requiring OHA to publish clear information on the background check process, requiring CCOs to reimburse providers retroactively, and also prohibiting the CCOs from requiring credentialed behavioral health providers to resubmit credentialing applications. So again, just a bill aimed at streamlining, and I know our team has been in contact with Representative Nathanson with her great work on this bill too. So those are the 4 in that space that we just wanted to make sure to highlight so that they're on your radar. Again, we can always get out more information if there are questions on how to make sure you're tracking those and want to participate in the legislative process. And like I said, we'll see agendas posting for these committees here in the coming days as we head through the sprint of the short session. So with that, I will turn things over to Casey to walk through the latest on House Bill 4083.
Thank you, Danny. And if you can just go to that next slide then, Chad. So I wanted to give this group an update on the work that has been being done on the bill that we presented on that was previously called LC Legislative Concept 216. Now that it has officially been dropped in the House, it is known as House Bill 4083, but it is the same entity. So after we had that legislative concept drafted and that request went in back in November, there's still an opportunity after that to potentially amend the concept through the amendment process. And so we've spent the past couple of months getting feedback on the bill, talking to people about the concepts in it, and we have identified a few places where we potentially want to sort of fix or make changes to the concept to make it more impactful, make sure that it's not doing anything unintended. And this is, like I said, sort of a natural part of the legislative process. A lot of the time people don't know what a bill is going to do or not do or accidentally do until they actually see the text of it. And so once you get that first chance to sort of go over the text, you're always going to catch some ways that you can potentially improve it. So just to go over the amendments, and these have been requested already. If you look on OLIS and look at the bill, you're not going to see these changes. You're going to see the original version of the bill because the amendment has not been drafted yet, but it is in process of being drafted. And the way that the legislative process works is that that would then be put into the bill during the committee. So you won't actually see the new language until we get to that public hearing on Tuesday. So the amendment is clarifying OHA's role in identifying and implementing the centralized payer credentialing portal. We really wanted to make sure, and we worked with OHA to make sure that we were being clear of sort of our vision for what we want to do here is not reinventing the wheel and creating a whole new system, but identifying the existing system that's going to work the best for Oregon and implementing that. And so we just clarified some language in the statute to make sure that OHA wasn't being directed to do something that wasn't actually what we wanted to direct them to do. We also clarified that the cross-license supervision portion of the bill only applies to master's level associates. The way that it was originally drafted would have allowed someone who is master's level to be supervising someone who was doctorate level, and that was not what was intended in creating the bill. So we just had to make the language more clearly represent the intention when the bill was created. And then to spend just a little bit more time on this last portion, we went and presented on the bill to a meeting of the Board of Licensed Social Workers earlier this week. We had an opportunity there to sort of hear from both the members of the board and members of the public who tuned in for that meeting to talk about concerns that they had for the bill. And one of the things that we sort of heard loud and clear was that people were very uncomfortable with the idea of the Board of Licensed Social Workers being moved under the Mental Health Regulatory Agency. That was something that people had significant concerns about. They had concerns about sort of the engagement process, about not having enough time for the Board of Social Work to be able to sort of respond to that concept. And so in recognition of that, in recognition of the fact that the workforce really, this was an idea that the workforce was not comfortable with at this time, we've decided to pull that portion of the bill out of the bill. So we're no longer moving forward with the portion that is going to be moving the BLSW under MHRA. I know when we had those discussions, there were concerns about the cross-license supervision portion of the bill as well. And I think the good part of kind of the process on that one is because the bill directs the boards themselves to make the rules around who are and are not qualified to provide that cross-license supervision, there is still significant opportunity throughout that process to make sure that we are opening up access to supervision without necessarily diluting the quality of the supervision or taking away from sort of the unique nature of the roles that each of these licenses provides in the workforce. So I just wanted to go into that in a little bit more detail to explain kind of why we arrived at those changes in the bill. But we are definitely determined to continue sort of engaging going forward with the boards and with the workforce to make sure that they feel like they have had an opportunity to really be a part of this process. And I think that as we look at the implementation of the rest of the recommendations from the Talent Council, there are going to be some really fantastic opportunities for our workforce, for our boards, for everybody who sort of cares about these issues to be really involved in our next steps of what we're going to be doing. I see Rick has his hand up. I don't know if I'm calling on people, but I'll call on Rick.
Hey, thank you. So I guess as an operational director out there, I'm not particularly, I don't really care how we get there, so long as we get there, right? For cross licensure supervision toward licensure. I'm really concerned, and I get like you know, if there's substantial opposition, the short session is not a place to try to get a controversial bill through. But I dearly beloved the licensing board for social workers, but I'm also very aware that they have multiple generations capability of maintaining their little niche and getting in the way of this. So it sounds like you're having to step back and try to work with the boards to provide some better cross licensure supervision? Is that sort of where we're standing? Which historically will mean that that won't happen.
So I think
I just know my licensing board, so that's all.
so ultimately, the bill does say that we are going to have cross-license supervision. What it allows is for the boards to decide, okay, who is going to be able to get to do that supervision? How are we going to make sure that people are qualified so that if you are going to be supervising someone with a different license type than the one that you have, we are confident that you are going to be giving them the kind of supervision they need. And our office will continue to sort of work closely with the boards and with other stakeholders to make sure that those conversations move forward in a constructive way. But I think that as we've been talking to people out in the workforce and everything, there is a real sort of appetite for making sure that we have as much access to clinical supervision as possible while maintaining the high level of quality that everybody expects from all of our license types. And Shira, go ahead.
Thanks so much. I just wanted to maybe clarify too that so currently LCSWs can supervise LPCs, but just not vice versa. And so that's the change that this bill is still going to see as an outcome. Is my hope that that's clear. And to just to read the importance of that component of this bill in rural Oregon as we really struggle to find, LCSWs when we have folks that require that type of licensure, and the challenges that it creates within organizations when we may have LPC supervisors who could certainly do that work, to your point earlier, First Lady, and just how helpful that piece of this bill really will be to rural behavioral health providers. So just appreciate the conversation and really hope that we can move forward.
I think that is all from the legislative update side.
Any other? Okay, that is. Okay, no other questions? Okay, thank you so much. Thank you so much. And as Casey said, just want to kind of slow it down, bring people along. I think there was some confusion also sometimes I think that there were some confusions about what things might or may not do. And so you just slow it down. But the goal, we have been focused always on the North Star, which is we need more providers in the Medicaid system right now. And the supervisions conversations have been everywhere we've been in the state. And so I think this is great work to continue to bring people along and also honor the great work people have been doing to try to get more people in the field and help our most vulnerable. And so with that, speaking of all of these awesome recommendations, it is time to think about the final report that y'all have done incredible work on, hours and hours and hours of work, of smart conversations, of working with each other, of connecting with people in the field to bring forward the best recommendations that we can have to really build this workforce. And so, Taylor, do you want to walk through kind of next steps and where we go?
Yes, thank you so much, First Lady. Hi, everyone. Good to see you. So the feedback that was discussed at the last council meeting that was in the PowerPoint presentation was incorporated into the draft report, which you all received in advance of the meeting. So I will just quickly kind of talk about next steps, and then we can move to sort of discussion about advancement. So in terms of next steps, the report, we have a couple other technical tweaks to make, including just making sure we're adding your right credentials next to your names and things like that on page 9 specifically. So we'll make those technical adjustments before sending the report to the governor on the timeline that we've been discussing throughout the council, which is January 31st. At that point, it'll go through a process at DAS Publishing to make it look very beautiful and add photos, at which point we'll then post the report on the council website so it's easily accessible and available. I know we have some questions in the chat that I will just respond to with the link to the website so that folks know where it is. There's also an email address as a reminder on the council website. So if anyone is reviewing the report on the public website and has ideas and comments, they can always send it to the email address that we'll continue to track as the governor's considering the recommendations in the report. So we will let you know when the final beautiful published version is available. It will again go on that website, and the governor will review and evaluate the recommendations and then determine what to advance. And there will be an opportunity for the governor then to come back to this group. We'll schedule a meeting in likely March or April to report out on the next steps. So those are an overview of the updates. And then Hannah, I think turning it over to you for a quick update on communications, and then we'll discuss advancement.
Absolutely. Thank you, Taylor, for outlining that process. Just wanted to flag that as we begin putting this release out in this report out into the world, there will be some more coverage and buzz around it, which is really exciting because these recommendations are really important for folks in the field. Just want to let you all know that there will be some press releases coming out about it, and you may see some coverage of testimony and upcoming inflection points in the legislature. I encourage you to share this coverage and share the report with your colleagues and those in the field. Feel free to share them on social media. We'll be sending you some social media toolkits to the communications contacts at your organizations. You're welcome to share them on your personal as well. But I think it's important that we get out to providers in the field the important work that has been done on this council to help support them. And so you will be seeing that stuff come your way, and I'm excited to work with you all to help amplify the lovely work that you all have done on this council.
Okay, and we have traditionally really just had a discussion and then advanced the work of the council. So we haven't done formal sort of votes, but have had lots of opportunity to discuss and provide feedback in writing and other mechanisms. So any other sort of final comments from the group before we have virtual fireworks and advance the report for the governor's consideration? Okay. Hearing none, then we are ready to advance to the governor for consideration. Congratulations, everybody.
Okay. All right. So let's see. Okay, so this is really exciting. I want to just recap while just doing all of these meetings for so many months, both your subcommittees and then having all of these meetings online that, while I recognize that requires extra energy, now anybody can go back and learn this stuff and follow along. And so while it requires a different kind of attention, I think that's been really valuable because anyone can go and watch the videos and hear the conversations and learn from the incredible work you all did. And I think that will be really important as the report advances. I am really so as we've talked about I want to this is what number of this the governor's been worked on has done a couple advisory councils, and so one of the feedback that we got and also what we've learned from other task forces, it's really important to understand what happens after your work, right? Is you make these recommendations and then it's like, now what? And so typically that we think that timeline will be somewhere around March, and the plan, and we'd like to reconvene everybody and give you an update on here were the things that because that is what you deserve, and that is and so I don't know when that will be, but just know that we'll want to pull people back together. I want to be clear about the commitment that we've asked you for, and so if you can't make that, totally understandable, but we'd like to offer that up, as well as an opportunity for us to everybody has done such incredible work together online for so long. And we'd really love an opportunity to connect in person. And I've heard feedback from you all that you're interested in doing that. And I am so interested in doing that. And we also have the opportunity to pair that with some advocacy, because the work that we're doing, that you all are doing, is front and center and continuing to talk about behavioral health workforce matters. And so we're looking to pull together a gathering with some opportunities to advocate. And so you should be look for an invitation around the week of February 16th. And then we'll also have an opportunity to kind of talk about the information in the report with legislators and people who are interested, because this has been a conversation that's been happening across the state for a while. And so it'll be an opportunity to also meet with folks and answer their questions. As many of you have relationships with as many of you around the state have relationships with your legislative representatives directly, and so you can have an opportunity to tell them a little bit more about your work. And with that, we're actually at the official end of our agenda. And it can't be goodbye because it just has to be goodbye for now. And I would open it up if anybody want to make any final comments. And I will hold some uncomfortable silence for a moment. Julie.
First of all, First Lady, it's been an honor to serve on the council, and I've been honored to be chosen as a vice chair. I have been so impressed with the work of this council. There are so many smart people working on all the behavioral health issues of the day, and it's just really fills me with a lot of hope. I also want to commend the governor's staff and OHA's support staff. Oh, the work you've done. There's no way we could have accomplished all this without you all. Just really outstanding work. And First Lady, I just want to thank you for your leadership, and I've appreciated this opportunity so very much.
Thank you so much. Eli.
Exact same sentiments as Julie. What I would add is I appreciated the welcomeness and the openness. Obviously, I shared some experiences from my own lived life and journey, and I felt very honored and to be able to share those, and in no way ever felt uncomfortable about sharing those. And it was really kind of this inflection point in my career where I was able to get to this point and to be invited into the space and to really, feel blessed by the individuals that were really taking in this and like really looking at it and like, oh, this is a person that's been in these various systems of oppression, my indigenous background and culture and my identity and all those things. And those, you guys took that feedback or took the things that I was sharing and really thought about those things, and those kind of guided and influenced your kind of thought process and how we all engaged. But the other really amazing part for me was that it was such an invaluable experience of learning for me. I was just so impressed by the, I mean, if cumulatively, if you think about just the years of knowledge and wisdom in this group, for me, that was just so amazing to hear. And some of you have been in the field for extensively long periods of time and seen the ebb and flow legislatively and administrations and so forth. And just to kind of hear your own personal journeys and challenges and struggles and rewards, of course, for me was also very rewarding, and I appreciate being brought into that too as well. And so, very honored and proud to be able to represent. And thank you.
Thank you, Eli. Rick, I think you were next.
Yeah. So I'm close enough to retirement that I don't need to be political or savvy or smart or anything, because I really don't care. But I do have to say that this is probably the best work group I've been on, and I've been on them for over 25 years. So Eli, it only goes south from here, and I'm sorry. Sorry to introduce you to the best one you're going to have in your career. But really appreciate, and especially your energy, First Lady. You've really brought a really nice energy to this, and the staff have been super functional and really appreciate it. And again, this is one of the best work groups I've been on, probably the best one in my career. So thank you.
Thank you so much, Rick. Thank you for all of your years and years of service and expertise. Julia,
Hi, how are you?
hi.
You know, I need to say thank you so much for pursuing me to sit in this work group. It's been a wonderful experience, and I just want to always talk about bringing the African American community into these groups because we get left out. And so when I'm asked to do things, it's, to represent our community, not knowing not having all the answers for our community, but at least bringing a voice for our community. And that's what's real important to me, especially in the state where we're such a small population. So just being able to come and talk about the experience of African Americans in this state and what we need to move forward. So I appreciate you pursuing me and not just dropping the ball because I don't answer. So thank you.
It is my pleasure. You have a very full plate, and it's been an honor. Been an honor. Director Pruzak.
Thank you, First Lady. So first, thanks to you. I have said, and I'll say it again here, if all First Ladies across our nation could care about behavioral health, it would be a blessing. So to have one that does, we are very fortunate. Thank you. And yeah, thank you, staff. I say all of the time, I could never do anything that I do without my staff. So thank you. And just, I think elevating how much work psych NPs do. When everybody has talked about different groups that get left out, we can be very physician centric, and we did not do that here. So thank you. And then lastly, I'll leave everyone with a challenge, maybe two. One, really think through all the things that you can do in rules and policies and procedures, and we don't need laws for. And hold on tight. This now has to go to the legislative session, and hopefully we'll all get updated to track it. Thank you.
Fantastic. Thank you. Liz.
Sorry, I have a new puppy, so I've been trying to run around and make sure he's not destroying the house. But I just wanted to say thank you so much for adding the voice of workers here. Like you, First Lady, went above and beyond to make sure that you were hearing the voice of workers, but not just hearing them, but actually implementing things that they were saying. I think as people with boots on the ground, we often feel like our voices aren't heard, and it's going to be upper management that's listened to, and that didn't happen here. And I just really want to, I've told my coworkers a lot about how that's happening on a bigger scale of being heard, and I think that that's really encouraging to them too. So thank you.
Thank you so much, Liz. That made me think of something, but I'll write it down. and close out with it. Thank you, Clarissa.
Oh, that was so similar to my thoughts. I wanted to say thank you. Well said, Liz. I wanted to say thank you to all of you who are on this council. I have learned so much and felt so honored to sit with all of you on this council. And thank you, First Amy, for choosing me. I'm not a politician. I've never been involved in politics. I'm just a provider. But the fact that you chose myself and Liz and any other of the boots on the ground people actually gives me hope. And I haven't had a lot of hope in politics recently. I may be a cynic, I don't know. But the fact that you want our voices and are listening to our voices and including our real, boots on the ground perspective, it's actually giving me some hope. So thank you for that. And I'm gonna kind of miss all of you. I've learned so much. Thank you for imparting all of your wisdom and for letting me just go on and on and on about the medical side of things. Yeah, but I'm so honored. Thank you so much.
Thank you, Clarissa. We've all learned from you. Ebony.
And I just, outside of my hat as a licensed clinical social worker and a community member, born and raised Oregonian, just in my role as OHA First Lady, I just want to thank you for your leadership and your commitment in terms of creating a pathway of action and accountability and, helping us, get across the finish line in terms of trying to put together some policy that's really going to be meaningful and demonstrate real impact. And so I just want to thank you.
Thank you so much, Ebony. Shira?
I gotta jump on this like celebration train. So I just want to thank everybody too. And I definitely agree with Rick, though he has a couple more years on me, that this is the best work group that I've ever been into. I'm not close to retirement yet, but this has been just really, really meaningful. And I think I just wanted to highlight too the representation in this committee just being so broad and kind of all encompassing, be it crisis workers and CADCs and LCSWs and LPCs and psyches and behavioral health doctors and educators, and like just the level of, boots on the ground and also expertise. And that we were all able to come together and have our true north be the behavioral health system and not any one of our own credentials or our own specific fields, right? Like my LPC credential or Clarissa's PMHNP, but that we're really here to support the behavioral health system and make meaningful, decisions and policy suggestions that support all of us. Is just amazing and also gives me hope. So just thank you for your leadership, and thank all of the vice chairs for your leadership, and thanks to your staff and also to OHA. So thank you.
Shira. Alice.
Well, it's going to sound like a broken record, but I just feel so grateful for your leadership, First Lady, and to our vice chairs, to Julie and Eli and Robin for just doing such an amazing job, and to the staff who, again, we've all been ruined for future meetings, as is made clear. I was thinking today about how this working in this space and learning from you all has changed my mind about things. And as an educator, that is so exciting. I also feel like I'm used to being on the sort of advocate activist side of things, where it's really easy to oversimplify an issue. And I really appreciate the way that we have been able to hold complexity and tension, and really, again, like to echo what Shira just said, like the North Star is what we owe to our communities, what we owe to providers of today and tomorrow. And yeah, I just feel like it's been transformative. And whenever I try to explain it to somebody, it's like you're trying to tell them about an amazing dream and you just can't quite put words to it, but you're like, no, you don't understand. It's so good. Anyway, thank you
Thank
all.
you.
It's such an honor to be with you. And I want to come to Salem whenever I can and fight for this. So hope to see you all there.
Fantastic. Robin.
I just want to jump in real quick. Alice said everything that needed to be said, so thank you for doing that, and to all the work that everybody's done. The only reason I'm popping on is just because I also want to lift up the work that was done by our HEC partners, because they
Yes.
have not been mentioned. And so really, we could not have done what we did without them. So thank you all, and thank you to everybody on the committee. It's just been an incredible experience.
Thank you for that, Robin. I am going to jump in here just to shout you out and to Monica for being the North Star on this, right? We were adding flesh to the bones of the recommendations that came out of the town. It's out of the assessment, and it has and it was an incredible document to be able to continue to work on, and it really that is one of the many reasons why this was able to be successful, is because we had something to start with. We had a great foundation. And so just wanted specifically to highlight both of you for staying with this process the whole time, because you went through that whole process, and then you saw this whole process. You've created some incredible continuity, as well as represented both the community colleges and the universities which is critically important. So thank you, Director Young.
I, I can be brief. I don't need to restate a lot of stuff, but I do just want to hit. I really appreciate the wisdom, the passion, the expertise of everybody that was on the council, the leadership of the chairs of the subcommittee, and I can't say enough the tremendous work done by the staff behind the scenes to bring information to each, between the talent council and the subcommittees, there were meetings going every week. There was a lot of work to pull together a lot of information and take that feedback back and turn it around the week later into something meaningful for the council to take and run again. So I'll leave it at that. Thank you all.
Thank you. Dan.
Yeah, I wanted to say, thank you so much. And I really appreciate this opportunity to serve. And, being a part of this work group has really been one of the highlights of my time in the field. And I feel like I've learned so much from everybody. And, just thanks for the opportunity. And I've really had a good time here. So I'll be sad to see it go.
Thank you. It's been really great to have you. Jamie.
To only just add that we should try to replicate, everyone is saying it, it's right. I go into a lot of dysfunctional work groups, and if there's any way that we could memorialize what we think was so effective about this group, and I think we know that, and to bring it forward into our other groups as we move forward, it would just be nice to memorialize that in some way or tell that story somehow so that we could bring it into our other work groups and flag what worked and why things felt so much better in this work group and so much more functional. So if there's any way to memorialize that, I'd be happy to carry it into my other meetings. But thank you for this opportunity.
Thank
It's been great
you.
for me.
I think that's a fantastic idea because I do think that and I want to, because I think it will also give us an opportunity to lift up all of the great things that were happening that people may or may not weren't always aware of. Like we had incredible staff that provided a guidebook the whole way, and you were able to have complex conversations and go back and forth, and then sort of land on a decision, and they were able to turn it around and then bring it back to the group. The crosswalk of all of the different work that has happened prior to now was Herculean and amazing. The collaboration between the multiple partners, having education come together with people in the field, having HEC and OHA work together. I mean, it's just you can't have everybody on a board, but we had a great smattering of people. This worked also incredibly well because you are working incredibly well. You're when I said it was like a team of superheroes in the beginning, that was serious. I mean, people are doing incredible work in their fields, and you're sharing best practices, and that's something that I was really informative in that, you know where you work and and the ability to learn from others. It doesn't happen very often, and so that really made a difference, and really smart staffing around how do we break up these groups to where it's not all providers and all educators, even though that would be interesting, that's what people like, but how do we work a little bit more intersectionally there? And so I think that was some smart things some smart ways that people put it together, and so it would be fun to kind of unpack all of that. I also just want to shout out and how important it was to have people. I loved that we have people that run clinics and people that are on the front line. I love that we have people with lived experience and people with PhDs. I love that we flattened a hierarchy here because I think that's how it really works. And I think that we know that we have to depend on each other, that we need peers, that we need providers, that we need medical people, that we need that and in the clinic environment, that's where it all happens. And I think that requires people did a great job of putting everything aside, titles aside, this aside, and just came to this work with such humility and wanting to learn and understand from each other. And I think that was one of the reasons that it was so successful. And it just I never worried that people would feel welcome. I never worried that people would feel uncomfortable sharing. And and that allowed for really rich, honest conversations. And sometimes when we don't, and these are recommendations, and do they have everything that they need? No, there's always more that we can add, and there's always more feedback to get. But people worked really hard. That there was lots of outreach, and I know, you know, people talked through at great length all of these details. And sometimes it was like, well, we're not really sure. Here's what we're going to put forward. Or if we don't know, we won't put something forward. But I just with so much certainty that it had been worked through. And so I love the idea of kind of recapping of what went well. I know that I gotta say, Taylor, I know you hate it but you're just so good. I do feel like Taylor in particular, just being a North Star and having done this work before and having an experience of how you run a council like this, and keeping us all organized. I know that was something a lot of people said is like, wow, I can't believe we got so much done because we all have so much to share and we see really tough stuff. And so how do we move from stories into recommendations into action? And that takes people moving us along gently, and keeping us on track.
And sometimes not so gently. We all do that sometimes.
Yes, and so but it was so helpful to have that because that over and over again, I think is the feedback we hear about groups is that we talk a lot, but then we feel good in the moment, but we don't really know where we're going.
Taylor, that was all love. That was just how we get us all. It's my joke about myself, so sorry.
Yeah, no, but it really did. Sometimes she'd be like, okay, I'm back to our agenda. I'm like, oh yeah, okay. And knowing that when there were good ideas, but they weren't within the purview of the work that we were doing, which always happens when you have a bunch of smart people coming together and being able to capture that and put it somewhere. And I know that the governor's behavioral health team learned a ton and it gave them other things to think about and work with agencies on that may not have come up they may not been in the purview of the council, but was just good recommendations and good things to know from people who are out there doing the work, which is it's really how government should be informed. Clarissa, is your hand up from still before, or is it again?
No, I just had one extra thing. I
Yeah.
remember when I met with you and Taylor my first time, I said, kind of at the end, I said, I'm going to be just straight with you. I really hate it when people who aren't doing the work make rules for the people who are doing the work without asking the people who are doing the work. And I think that one thing I've noticed about everybody is incredibly committed to making change, real change, because we've seen how hard doing the work is, and the right voices were included. To be quite honest, when I said that, I was like, well, there goes my chances of being on that council. Like, I was like, oh gosh, I just screwed my chances there. But that, lo and behold, that's what you were looking for. And maybe that's where the magic lies.
Yes, the candor of this group has been fantastic. I do have to shout out Rick just because I love how he's like, I've been doing this a long time and I'm going to speak the truth. And I just think that that has been so helpful. And I know people have been able to have robust discussions, but that really does matter. It really does matter to get into the weeds about what's going to work and what's not going to work. And many of you are on other boards and other councils, and so it's just we owe it to you to try to see this through as much as we can and see these recommendations to somewhere, because I think that sometimes is the frustration, and people shared that very candidly, and I think that was absolutely a lesson learned to how do we keep bringing people in, to be able to do that. And I'm just so excited. The other thing I would say, and then we should wrap this up. I had the opportunity to travel around the state, not only first with the governor and her One Oregon tour, and meet with providers in almost all of Oregon's counties. And then I had an opportunity again to go back as we were doing the talent council, and we'd have our field trips. And the amount of, as we're talking to these folks, just how it creates some hope that that people are thinking about making this sustainable. Um, and particularly for our youngest workers, it just really mattered. And so I just want you to know that just being able to do this and tell them we're working on this, being in a secure residential and also being able to share the good work that has been prior to this, just about people being able to access more beds. Like that, when people are working so hard and doing things that are so difficult, to just let them know that people are thinking about them and they're trying to make things better. Just, it was something that I got to experience, and it was something that I got to see, but it was your work that I was seeing. And just know that that is making a difference already, and people just feeling like there is a group that cares about them and recognizes that this work is really hard, and that the funding structures are difficult, and that we live in a very difficult time right now. And that while we will fix as much, we will fix and address as much as we can. And I always like to go back to what the governor likes to do is you come up with the best plan and you fund it as funds are available, but it doesn't mean you don't create the best plan. And I think that people have been really good also of staying on that, considering we've had significant changes in the federal landscape and the resources that are out there, which makes it even more important of knowing what's going to be the best use of resources to get people in the field and have them stay in the field. And we're gonna end on time because we always do, mostly because people are so great. Again, it's not goodbye, it's just goodbye for now. Look forward to getting people together in person, and we'll talk more about offline about how to do that, or off on email and other ways about how to do that. Look forward to getting people the whole report for everyone to see and go through. And then look forward to reconvening people sometime in March. I'm not sure when, for the governor to talk a little bit about next steps and what recommendations are able to move forward. And with that, thank you so much for your time and dedication. It's really, truly been an honor.